Congress enacted what has become the largest federally funded program for people living with HIV and AIDS 20 years ago today. The anniversary of the Ryan White CARE Act will be commemorated on the steps of San Francisco City Hall. For more, we're joined live on the KCBS Newsline by Randy Allgaier. He is director of the San Francisco HIV Health Services Planning Council, which prioritizes and allocates the Act's funding in Marin, San Francisco, and the Peninsula. Good morning.
Good morning.
You're expecting almost, $30 million for this fiscal year. I know that sounds like a lot, but funding has gone down over the past few years, hasn't it?
Yes, actually, this past year it was $26.5 million, and at our height we were close to $40 million, so I think that gives you a sense of where things are. The pace of funding has not kept up with the course of the epidemic, and as the epidemic has spread throughout the country, those areas that were hard hit first, saw cuts happen from our funding as well.
Because we do need to be clear about this. While the overall picture for AIDS and HIV may be a little bit better these days, what with the drug cocktails, the numbers are still high. In San Francisco, the numbers are up instead of down.
Well, we do have more. We have kind of a steady rate of new infections each year, but part of the good news of folks living longer is the fact that we have more people living with AIDS and HIV than ever before. So that adds a lot of pressure to the system of care because there are more and more people needing to access that. And at the moment, there are currently about 20,000 San Franciscans living with HIV and AIDS.
And with those numbers being up, like you said, that there are people who are living longer with these issues, does that present other kinds of medical issues that doctors may or may not be ready to address?
Well, it certainly does, and actually it is an area that the Council has worked on a lot this particular year and is becoming an issue that a lot in the medical field and social sciences are beginning to address, because the issues around aging with HIV and long-term living with HIV pose a myriad of issues from a lot of chronic different conditions that people find that they have. We see more non-AIDS related cancers. We see more cardiovascular issues that go on. You have the issues that are kind of just general with aging that are exacerbated by HIV. We don't know the long-term effects for a lot of the drugs that people are on, because, quite frankly, this is the first generation of folks who've been on these drugs for a long period of time. One person at a meeting once said that he was kind of tired of being on the cutting edge of this epidemic, and I think that probably speaks for a lot of the folks who are in that category of people.
What are some of the projects and some of the areas that benefit from Ryan White CARE Act money?
Well, medical care, definitely, for those who cannot access Medi-Cal or have private insurance. Definitely, the AIDS Drug Assistance Program is funded through Ryan White funds as well, which means that the very, very expensive drugs that people need, that those costs are defrayed to some extent. I think another very important part of the social wraparound services that people need to stabilize their lives, case management, psychosocial support, emergency financial assistance, a variety of things that people really need in order to make sure that their lives are in a stable place so that they can actually have success in their medical treatment, because the medical treatment is complex and the issues that people face are very complex. So ensuring people are in a place in their lives where they are able to succeed on that very difficult medical regimen is important.
Mr. Allgaier, final question for you, and that is, with obviously the help still needed here in the Bay Area, do you feel like you're getting the assistance you need from the state's senators and our representatives in Congress to make sure that this money keeps coming?
Well, I'll tell you that one of our biggest champions has always been Speaker Pelosi, and continues to be. So we certainly have a great friend in her, not just here in San Francisco, but nationally. She has been a champion for HIV and AIDS. So yes, we do have that support from Congress, and I think locally our elected officials have constantly prioritized HIV and AIDS funding when we've seen gaps that need to be filled. They've tried to do that. At the moment, the state is having its own fiscal issues that make it very complex to kind of get a sense of how they're going to react. And I think the biggest issue around state funding is how Medi-Cal will end up getting through this next fiscal crisis and how intact those services may be. But definitely, we certainly have a lot of champions among our elected officials here locally. We're very, very lucky.
Randy Allgaier, thanks very much for joining us. He's director of San Francisco's HIV Health Services Planning Council, commemorating the 20th anniversary of the Ryan White Care Act.